Hi, everybody. Ooh, excuse me. Hi, everybody. Megan Thompson here, and I wanted to talk about the 3 things that you can ask yourself to stop anxiety-related behaviors for your highly sensitive child before they start. So, I really wanted to talk about this today because I think it's so important for parents of highly sensitive children to prevent anxiety-related disorders. And one of the things that I think is so needed in terms of your knowledge bank of parenting a highly sensitive kid is the understanding of what is anxiety and what is being a highly sensitive child and what's typical behavior for a highly sensitive kid. Because if you're clear of what's typical behavior for a highly sensitive child, then when you start to set parameters around how to parent and set your expectations on what's true and typical for a highly sensitive child, then you are setting yourself up for success for not perpetuating problems, for emotional problems for your highly sensitive child that leads to symptoms of an anxiety disorder, that has you knocking on the therapist's door who may or may not know about the personality trait and whether or not your child's behavior is typical for their personality, typical for their intense experiences in the world, and may pathologize it, which, in layman's terms says there's something wrong when there's something isn't, and makes your child wrong for feeling big feelings. And so one thing that we, really work on with parents here at MTC is helping parents understand what's typical. What's typical? What are typical expectations for a highly sensitive child? What are typical expectations for any child, let alone being highly sensitive, because many of you have multiple kids. And again, what's important to be aware of is the understanding of what's typical for development for all children, and then what's typical for raising a highly sensitive kid, and how to ensure that the way that you're parenting your child is fitting how the 20% of the population needs to be raised. Because if you're raising your kid with standards that fit the highly sensitive, that fit the non-highly sensitive population, the 80%, how you are raised, how you see most children should be raised, then you're going to set yourself up for significant challenges as your child ages, and set your child up for significant challenges because you're not comparing apples to apples. You're saying, my child is an orange, but they need to learn how to be more like an apple. And while I understand they're an orange, they also need to deal with lots of apples. And so while they are an orange, they need to be more like an apple. So many of you are probably having this conversation with your spouses. And, I was speaking to a parent earlier today about this dichotomy of not setting your kid up for developing increased expression of their sensitivity, increased expression of intense emotional behaviors, and emotional expression that lead to ineffective behaviors, because she's worried, and her husband is worried that they're overprotecting their son, and that they're saying that there's a problem when there isn't one. That's one side of the spectrum. The other side of the spectrum is, everything's a problem, and it's because my child's sensitive, and so therefore I must save them from these problems. I have to protect them from the world, and put this bubble, make my kid bubble boy, like that movie that I never saw it, but I don't know if you guys remember that, like big plastic bubble, and the guy was like walking around in it. I can't remember who was in that. Is it Jake Gyllenhaal? Anyways, again, just noticing what it is for you guys in the dynamic. And again, if you're here live, say hi. If you're catching the replay, #replay, ask your question so I can help you discern this. What I think is really important for you to get clear on is how to assess your parenting, because we all want to raise children who are healthy, right? Not just physically healthy, not just, nutritionally healthy, but emotionally healthy, emotionally independent. And what I want to do today is talk about that and the questions that you can ask, and what it takes for you as a parent to ensure that the way that you're parenting is setting your highly sensitive child up for success. Because if you're stuck in this meltdown cycle of daily meltdowns or daily outbursts, daily intense expression of emotion, then you're moving towards a pattern of your child feeling like they're incapable of managing their emotions. And without getting very clear on how to assess your parenting, how to assess how you're setting up the environment for success for your highly sensitive child, then you will not be able to move yourself out of this, and you'll need support in doing that. And again, obviously I'm here, but for many of you, feeling as if you can do this on your own, you need to know how you can justify that decision. And so that's what we're going to be talking about today, because especially for those of you in two-parent households, or for those of you who have family members who are maybe telling you the opposite, when you feel like you don't know what you're doing, and you know that there's significant risks in supporting your child the way that you're without clear direction. This is what this is for. So I'm going to actually take a drink. I should have done that before I get started, but and then we'll roll into what we're talking about today. Sorry for those of you who are audio sensitive, that echo that I'm speaking into my water bottle. So, guys, what we're talking about is understanding first the symptoms of anxiety and what anxiety looks like for a highly sensitive child. Because when you think about how society typically manages this, they go to a mental health professional to manage symptoms of anxiety. And so 80% of the population goes to therapy and may or may not get results from that. And, just depends on who you're working with and whether or not they're learned in treating children, and as well as learned in treating children with anxiety disorders. And then whether or not they can get the outcomes that you're looking for. So that's one thing to consider. But when we think about what's so important to be aware of if your highly sensitive child is on the track to developing an anxiety disorder, you really need to know how to circumvent that, right? Because we don't want that. And we need to know how to recognize the signs and turn it around, and when to seek help so that you don't end up in that position. Because once you're in the position of seeking support and taking your kid to therapy, there's a whole host of other, just complications that you need to manage. So getting to the appointments, dragging your kid to the appointments, getting your child to admit to needing support, and being open and honest in the therapy session, and being able to communicate whether or not the therapist is using play therapy and the child is being open and honest in their play and communicating that way, or using talk therapy, and whether or not that's actually proven to get results for highly sensitive children based on that clinician's track record. And so there's many things that you're going to need to tick off if this ends up further down the line and you don't turn it around. So I really want you to be clear that you're going to have to deal with it either way. It's just a matter of what part of hard you want to deal with. One of my coaches says, pick your hard. And I love that, because it's hard to do it and to prevent it and to set up a routine and to schedule things that, aren't necessarily come natural to me. And it's harder to deal with the fallout of that. So, but that's a tangent I went on. Sorry about that. So let's get into understanding the symptoms of anxiety and understanding where they fit for highly sensitive kids, and then getting very clear on how to assess yourself and in your parenting, because you've likely been following me for a while and you've known that parents of highly sensitive kids are the ones who need to adjust their approach in order to prevent any mental health needs for their highly sensitive child, barring an experience of trauma that leads to the obvious need of seeking professional support outside of the home and as well as inside of the home. So just recognize that that's what we're talking about here. We're talking about general, run-of-the-mill, typical 80% parenting that works with 80% of the population, that doesn't work with highly sensitive children, that then leads to significant challenges for your highly sensitive child in terms of how they view their world, how they view themselves as capable of solving their own problems, and how they feel in terms of their relationship with you, and how that disrupts your attachment as a parent in parenting your child. So that's what we're focusing on here. So when we think about the definition of anxiety and the clinical definition of anxiety, I have a training on that for you guys. If you're on my email list, you should be getting that. I'm not going to dive fully into that. That was the focus of the interview I did earlier this September. And PM me if you want the link. If you didn't get it, I'll send it out to you. But what we're talking about here briefly is that if your child's emotional expression of worry is debilitating in the sense that they're refusing to do what they need to do, or they are so worried that they can't feel confident or capable of solving their own problems, and that's persistent for 2 weeks or more days than not, then your child is on their way or has already developed the symptoms of an anxiety disorder. Now, guys, for those of you whose kids have been experiencing meltdowns for their entire life, you can see how if you were to show up on a therapist's door and they diagnose it, an anxiety disorder, that doesn't match, right? You're going to get skeptical. You're going to worry about, does this person really understand me? Do they really get what I'm doing here? So I really wanted to equip you guys with the understanding so you can advocate for your kids' needs and you can seek support in the way that needs to happen for your family to prevent this. But obviously, if you're there at this point or your kid's dealing with daily meltdowns, then you need support now to turn it around. So understanding what's going on is the understanding that your child is refusing to do things that a typical child would be expected to follow through on more days than not. Kids are kids, right? So they're not always going to want to go to bed on time or always want to get up for school or always want to go skipping into the day they have a test. But more times than not, if your child has a meltdown or a forceful or aggressive refusal or is throwing things related to expectations that you place on them every day, in terms of it not being a surprise that they would be expected to do X, Y, Z, go to bed, do their homework, whatever. And you can add it all up. So just take, I do this on the phone with parents when we talk, add it all up. More days than not, is your child melting down related to these things? If that's the case, then that's a consistent problem for highly sensitive kids, and that's a sign of anxiety and a developing or already developed anxiety disorder in a highly sensitive child. So again, very clear that your highly sensitive child is not developing typically an emotionally healthy way if they are experiencing daily meltdowns or more days than not out of the month for multiple months, their whole life. That's very, very concerning for you as a parent. And so that's the first thing. The second thing is that these meltdowns, for it to meet the criteria of an anxiety disorder, have to be observed to not be due to overstimulation. Now, overstimulation, as we know, is the second part of the personality trait when we think about the 4 components. And so what's very important to know is that your child might be overstimulated by a thought in their head that they've been spreading and spinning around on all day long. And that has led to increased intensity of emotion. My husband's like, "Where are you?" Coming home soon. Intense emotion, right? And so your kid's thought is creating that intensity in their body, in their brain, and in their emotional experience. And so if that's happening and they are responding to you in your request to, go upstairs and go to bed, and you share that with a professional who's trained to discern an anxiety disorder, like a mental health professional or a pediatrician per se, they're going to look at that, cause and effect environment. And if they are not clearly understanding how intensely your child can be overstimulated by their own thought process, then they could very well say that your child can just be struggling with expectations, and then that's what's creating the worry. And if your child is highly sensitive and it's hard to get things out of them, you feel like you're, pulling teeth to really understand what's going on, and you only hear what's worrying them after they've exploded or in the middle of an explosion, then, or after, months and in an explosion of something that bothered them for months, just think about how that will turn out when you're working with somebody whose sole focus is to get your kid to talk about what is bothering them. There's a mismatch here in terms of expectations, so you really need to work on and work with an expert. So in the field, because it just sets your child up for feeling like they did something wrong when they're not comfortable addressing their problems with a stranger or somebody who they've been working with for a while who just isn't using the right approach. So again, we're talking about where you'll end up if you don't turn this around. So now when we think about how to turn this around and what you need to do, we're focusing on is building the foundation. So the 3 questions I want you to ask yourself are these. The first one is, when you're parenting a highly sensitive kid, it's very important to evaluate that environment that you're parenting in. And so how does the household run? What are your expectations on a daily basis? What routines do you have set up that support your highly sensitive child to feel successful in their day? What are you requiring your child more days than not to suck it up and deal more often than supporting their emotional expression as they only know how to do right now? So if your child is having daily meltdowns, that's their only skill. They only have the skill to express their emotions at that level. And if that's happening, that's their go-to skill, then your expectations in parenting your child need to be gradual in terms of what your end goal, which is, Mommy, I'm very upset this happened, or Daddy, I don't like the way that you the way that you asked for me to do that, or Mommy, can I do this in 5 minutes instead? And I'm almost done with XYZ. Just about to finish, versus, all right, I'm done. Just this straight 0 to 60 scream fest, or I never get to finish, and then meltdown. Whatever the reaction is for your child, if your child's going from 0 to 60 as their go-to, and this brings me to my next point, and your expectation is that they go from 0 to 5, then your expectations need to be gradually increased, rather than just going, expecting your child to go from 0 to 5 right now. That's a giant gap. And then the next thing that I think is really important in terms of understanding that is if your expectations are for your child to go from 0 to 5 in terms of their intensity of emotion, but right now they're going from 0 to 60, then it probably means that you're waffling from giving in, fine, here, whatever, to giving up on giving them any sense of understanding or any sense of a say in what's going on, and you're just saying, nope, that's it. I give up on your ability to be independent. What I say goes. So it's this pendulum. We work with my clients all the time and figuring out where they lie in that pendulum, and oftentimes both parents are in completely opposite pendulums, and you guys, you swing each one, or both are holding the other end, and it's just, you end up crazy making, and it creates a conflict in the marriage as well, or the relationship. And so that's really, really important. That's the second stage of finding balance. And then when we think about the third question that you need to be focusing on for your family is really understanding how to help your child advocate clearly for their needs. Because if that's the first step that you're going to, you're skipping ahead way too fast. And this is why I speak so often about how it's so important to be systematic in how you change how you parent your child. You can't cherry pick what seems more applicable without a step-by-step plan, because if you're not clearly identifying the priority in terms of how to get your child from A to Z, then you're going to start by expecting your child to already be at G and your kid's at A. So you're going to start teaching skills when, expecting your kid to already be here when your kid's over here. And this is the spectrum of completion of, my child can communicate their needs clearly more days than not, has a healthy conversation about what it is that's that they don't want to do. So, for example, healthy expectation for a 3-year-old is to say, I don't wanna. Okay, Mommy. And then to turn it around. And so yelling is something that can be healthily expected of a 3-year-old to maybe 3 times a day. Daily meltdowns? No, I would not expect that of a 3-year-old. So just notice that. If your child goes, and just says, but I don't wanna. And then once you say, you hold a limit, or you say, oh, that's hard, and they say, yeah, it is hard, and then they help you and work with you to solve the problem, that's developmentally appropriate. So just be very, very clear with yourself about what the general age expectations are for your child. And if your kid is 7 and they are 3, 5, 10 times a day yelling at you when they don't want to do something, or when they feel surprised about what your expectation is, even if you gave them 5, 10-minute warnings, or put it on the calendar, all that jazz, then that's not developmentally appropriate. 7-year-olds should be able to more regularly than not, more often than not, even when they're highly sensitive, experience the experience of being surprised, manage it themselves, internally shift their demeanor, and then use a coping skill if they need to, and then respond to you. Might still not respond to you by saying, okay, mom, like that's different. Compliance is different than emotionally and learning how to manage your own emotions. And that's very, very important, guys. So, because our end goal is not always to have very compliant children. Our goal is to have emotionally independent children, because when they're emotionally independent, they follow through on their expectations more. So very, very clear on understanding that. And then next is really just understanding where your child lies in terms of the developmental expectations of a highly sensitive child, not developmental expectations of the other 80% of kids. And so what parents can really get tripped up in, and where I see parents get trapped, is by saying, well, my child needs to learn how to respond in day to day, and they need to not have their sensory processing sensitivity be a crutch. Yes, absolutely. That's why we talk about emotional independence. We focus on developing those skills for parents that I work with in boot camp, and understanding that is absolutely the goal, and absolutely should be your focus at parenting any child, but especially a highly sensitive child, because when your child is more vulnerable, more at risk to be a people pleaser, more at risk to be a follower, more at risk to suppress their own needs in order to please others, more at risk to suppress their own needs and then to explode on others, then it's very, very important that you're teaching your child how to recognize and understand their emotions. And you're not doing that in a way that's saying, well, here's the world, do it all at once. Because that's like drinking from a fire hose, and you can't do that to a 3, 4, 6, 8-year-old. You need to gradually implement that expectation. It's basically like walking outside without any clothes on and saying, like, learn how to be warm, learn how to warm yourself internally, like think warm thoughts. And my daughter's into Frozen these days. I held off as long as I could. She's 3.5, and we just watched the first Frozen movie a couple weeks ago, and so Olaf's on the brain. Hi, my name is Olaf. I like warm hugs. And just that understanding of, like, I'm a frozen being and I can tolerate something warm. That's a skill that's developed, to learn how to back away from that warm experience so that you don't melt all the way. That's a learned experience, and you can't just expect your child to, to learn that by trial and error, or by feet to the fire. Highly sensitive people don't learn feet to the fire. They freeze. They retreat, and they get into fight or flight experience because their nervous system is wired to up the ante into fight or flight. And so highly sensitive people need some time to gradually learn specific skills, and they need time to practice. And so the same is true for your child. It's nothing different. So just to be very clear for you that if your expectation is to prevent or circumvent the development of an anxiety disorder in your child, then you need to know that you're raising your child the way that they need to be raised. That you need to know that you're raising your child with the understanding and the clear direction of raising a highly sensitive child, not any child who just happens to be sensitive, because there's a big difference between raising a child with sensory processing sensitivity and a child who sometimes doesn't like it when people yell at them. That's just a very, very clear indicator of a misunderstanding of the personality trait. and just perpetuates that suck it up mentality of recognizing or feeling like you need to teach your kid to suck it up in order for them to get over in the world. And it doesn't work. I mean, we see this day in, day out at my private practice, and with parents who have come to us through boot camp, using the suck it up mentality. It not only does it or even a modified version of that, guys, it doesn't help your child learn how to notice their own signs of intense emotion. It also doesn't help your child learn how to trust that you can help them manage their own feelings. And so when all of those things are true, then your child doesn't develop the internal trust of their own emotions, because if they can't reach out to you as their parent to learn about their feelings and to learn how to express them safely, because you're telling them that they need to keep on keeping on regardless of them, then how can they learn to trust themselves? And that's the bottom line core understanding of a healthy parent-child attachment, not to be confused with attachment parenting. And the philosophy that your child needs to be with you all the time, and things of that nature, that some parents who decide attachment parenting is not their cup of tea, it doesn't mean that you shouldn't still focus on developing a healthy focus on attaching your child to you as their caregiver. And so it's important, as we talked about earlier, that the pendulum swinging that's going on in your household, likely if your child's engaging in daily meltdowns and through no fault of their own, it's not on purpose. But it's also true that you can't look at the extreme of, a parent who's saving their child all the time and rescuing their child from intense emotion all the time and say, well, I don't want that to happen, so therefore I can never help my child manage their emotions. They need to learn. That's the other end, right? So just get very clear on where you're at on those sides of the spectrum, and really focus on getting yourself in the middle and assess yourself over time. And if you'd like to fast track that, if you don't want to trial and error it, if you don't want to DIY this experience, and you want to help your child, and you want to stop really focusing on struggle and start focusing on feeling empowered and move into 2020 with a plan, then I encourage you to reach out, because I'd be happy to speak with you about what works and how to support your child and how to support yourselves in parenting in a way that allows your child to feel their feelings, communicate their needs, get their needs met in healthy ways, and then move on and get back to playing. Because that's what life is all about. So go ahead and call, set up a link to call me on meganthompsoncoaching.com/talk. And we'll talk about where you are, where you need to be, and whether or not I can help you get there. And just recognizing that your core goals here are to focus on changing the dynamic for your child so that they are growing up to be healthy, independent teenagers and healthy, independent adults, even more so than your child once they hit the adolescent stage, and they become less focused on hearing what you have to say. It's just a nature of the beast of adolescence, as we all know. We've all been there. So that's it for me today. Again, in terms of lives, I'm traveling next week. I don't know that I will be on here live next week with vacation coming up, or the holidays coming up. So if this is the last time that I see you live, happy holidays, and have a wonderful holiday season. I'll talk to you soon. Bye.